Good morning to everybody. I am Dr. Vilasarao Gorpade, SGM College, Karad. Today we will discuss about radioimmune assay. So, radioimmune assay has done the great job, revolutionary job in immunology. So, basically, almost all in diagnostic purposes, radioimmune assay is used. So, we will study what is the meaning of the radioimmune assay. So, in radioimmune assay, a protein is going to separate it with the help of specificity of the antigen and antibody reaction mechanism, and their quantification or quantitation is carried out with the help of radioactivity. Means you have to label something and you have to find out how much amount of the antigen and antibodies are there. Antigen attached to the antibody, the titration of the antibody is carried out. So, radioimmune assay is the very important technique which is used in medical sciences. So, this technique is generally used in blood banking. So, there is a blood banking, it is very important because generally bloods are contaminated with the hepatitis B, or sometimes it will be contaminated with the HIV virus. And when there is a presence of HIV virus, when you have to test it, for this testing purpose, this technique is used. Now, sometimes the people are suffering from allergens, and this allergy can be detected with the production of the IgE. The IgE, when it is produced in case of the blood, that IgE is detected with the help of this technique. So, diagnosis, endocrinology means maximum medical sciences which are using for diagnosis procedure, this is radioimmune assay. Now, basically how it is came into the existence, that is a historical part is very important, that who has discovered this and he has brought the revolution in the medical sciences. The Burson and Erlo, these are the name of two scientists. First, initially they used this radioassay technique for diagnosis of the level of insulin in the blood plasma. How much insulin is there in the blood plasma? For that purpose, they have devised one methodology that is called as a radioimmune assay. And they have done it in vitro assay. Now you know the in vitro and in vivo. In vivo means in animal, in vitro means in glass. They have detected this one with the help of radio labeling. Now what is the basic principle of this technique is, there is a competition between the labeled antigen and unlabeled antigen. There is a competition between this, and you have to add limited numbers of the antibodies. Now you know the number of antibodies which you are going to add, and how much antigens are there, that antigens are react with the antibody, and if you measure, that is directly proportional to the amount of the antigen which is present in that. So this is corresponding labeled antigen for limited number of antibodies are added at the binding site and the fixed amount of the antiserum. And you know that when there is a number of antigen is equal number of antibody, there will be an equilibrium. But this is not possible in case of a live system, because sometimes antigen will be excess, sometimes antibodies are excess. So, understanding the standard conditions, the amount of labeled antigen bound to the antibody will decrease the amount of unlabeled antigen in the sample increases. So, unlabeled antigens are there. That unlabeled antigens you can elucidate out, and whatever labeled antigen if you measure, then that will determine exact number of antibodies. For example, there is 4 antigens are labeled and there are 4 antibodies are there. When you react to the 4 antigen and antibody, there will be an equilibrium. This is the equilibrium case. Now here, there are unlabeled antibodies, antigens are 4 and labeled antigens are 4, and the antibody is available, that is 4 only. So there will be unequilibrium, there will not be equilibrium. So that's why 2 antigens which are labeled, they binds with the antibodies, and 2 will be, they will never bind, because remaining 2 will be, this is unlabeled antigen react with the antibody. So that's why this 2 antigen will remain as it is, they will not be react with the antibodies, they will remain as it is. This is 2 antibodies which is unlabeled, they will remain as it is. So there will not be, means what it suggests, there is excess amount of antigen and antibodies is there. So there is no equilibrium. Same is the case if you take the 12 antigen, when there is a labeled 4 antigen, 4 antibodies, this labeled antigen will react with this and remaining all will be remain as it is. So that's why by taking the advantages of this, the principle of the immune system, principle of radioimmunoassay is best. Now what is this? Generally this is one of the important ways to estimate the ligands. Now this is antigen is there, this is labeled antigen, this is unlabeled antigen, this is antibodies. This antigen is react with the antibodies. This is unbound antigen is remain as it is. This unbound antigen can be washed out. So these are the washed out and whatever remain is that. So radioactive is bound residue is measured. This is very important. We are measuring the bound residue of the radioactivity. So this lesion concentration is inversely related to the radioactivity. So radioactivity is the one of the important phenomenon which is used for the estimation. And if you increase the concentration of unlabeled antigen with increasing amount of a radioactive antigen, displacement from the antigen antibody molecule takes place. We will see in next slide how the displacement is carried out. The antibody bound antigen are separated and free antigen is supernative fluid. The radioactivity each is measured. Now this is the best example. Diagrammatically we are representing how it is carried out. Just see this. This is a radioactive antigen. These are the antibodies. These are antigens are there. They are radioactive. This is the first antigen antibody reaction. Now radioactive antigen are attached to the antibodies. Then you in that you add unlabeled antigen. These are the blue color. This is unlabeled antigens you are going to add. Now I told you basically there will be some sort of displacement takes place, some sort of displacement. So this is a radioactive antigen is displaced by unlabeled antigen. So this is a displacement, this is a blue color is attached. Initially it was red, it is a radioactive, so displacement is takes place here. Now this is a total what we will call as unlabeled antigens are attached. So when this is carried out, the participate the antigen antibody complex will form, that is anti-immunoglobulin is synthesized against that. That is this is another antibody is synthesized. So this one, this radioactivity of the supernant, this free antigen, again they bound with this one, this antibody, this is called as a second antibody. Now this can be used by calculated with the help of gamma counter. You can use the gamma counter and you can calculate the amount of this one. Now if you see if you plot the graph of this one, that is from this data you can use a standardized curve and you will get the standardized curve. From that you can measure the labeled and unlabeled antigen which is present in the serum. Now this is another graph. The sample is assayed. Now whatever you blood sample or plasma sample you are going to take, that plasma sample is there and this sample can be used for this. After determination of this, the ratio is bound and the graph is plot against the concentration, you will get the unknown concentration of this one. Now you want to estimate the number of antigens are present or number of antibodies are present. For this purpose you have to plot the graph and you have to carry out the experiment. So there are basic drawbacks in this method. What is their drawbacks is that because this is a highly sensitive, high amount of the radioactives are required. So that's why it is a highly expensive in nature. This is expensive in nature. The cost of this test is more. And second one, it's a handling of the radioactive level compound. It is a hazardous to the health. So these are the two drawbacks of this technique. If you go for 125, that is a radio level compound, and 131, that emits the gamma radiation. And that causes the effect in the technician. So that's why this is very important, and this causes the drawback in the testing of the thyroid gland. This is the thyroid gland where the testing is carried out with the thyroxine, whether this is not possible for this. Now even though this is the drawbacks, these are the drawbacks of this test, there are few and very important advantages of this technique, because it is a very high level, very sensitive technique is there. So that's why this radioimmune assay is widely used with great sensitivity. Say for example, using antibodies high affinity, you can measure, you can detect 10 raised to minus 12 grams of the antigen which is present in the blood sample. Now the accuracy, just see a very little amount of the antigen is present in the blood sample that can be tested with this method. And with the greater specificity of the antiserum and having the greater specificity of the assay is carried out. Now, even though this is true, the radioimmune assay becomes a major tool in medical science because highly sensitive methods are there. This highly sensitive is used in the assay. Now, most of the plasma level, most of the hormones are there. Now, you might have been knowing the growth hormones are there. This is one. Second one is sexual hormones are there. These hormones are there. And because the hormones are very important in the fertilization. The level of the hormones determine whether to fertilize or whether not to fertilize in case of the woman. So, for this purpose, you have to detect the hormones. So, most of the hormones are tested with the radioimmune assay. Digitoxin, digoxin in the patient receiving the drugs. Many of the patients are there. What is the residual concentration of the drug is present in the blood? That is also matters more. And when the residual concentration, you have to calculate the residual concentration of the drug which is present in the blood. For this test is carried out. And certain abuse drug. Now you are well known with the fact many people are drug addicts. Now the question comes, when you have taken the drugs, what is the actual level of the drugs should be tested with the help of radioimmune assay. Abused drug means, say for example cocaine, say for example morphine. These are the abused drugs who are taken by the person you have to detect. Now even though this is true, if you see in the blood bank or if you donate the blood, whether that blood is contaminated with the hepatitis B or not. For that purpose, you have to carry out this radioimmune assay because you can detect the surface antigen for hepatitis B is present in that blood or no, you can detect with this anti-DNA antibodies. That is what you call as a radioimmune diseases. The many of the person and the most of the person they suffers from autoimmune diseases. Say for example, systematic lupus erythematosus. Now, what is this autoimmune diseases? A patient, when the antibodies are synthesized in the body of that patient against the self substance. The basic principle is that our body never produces any type of antibodies against your own substances. But there are certain sequester antigens are there in our body. When the sequester antigen, they leave their places and enters into blood circulation, then this causes antibody synthesis takes place, even though it's own body, even though it is a self substance. The antibodies are synthesized against it. That is called as autoimmune diseases. Now, what is basic application of this test? So, whatever blood donation camps are carried out, that Rotary Club and other colleges, many of the blood donation camps are carried out. But whether that is a blood is contaminated with the virus or whether the blood is contaminated with the hepatitis, for this purpose radioimmune assay is carried out. That is HIV-1, HIV-2, the presence of antivirus antibodies or whether it is present in the blood sample that is tested with the help of radioimmune assay. Second one, if you see the hepatitis C, when the patient is suffering from hepatitis C, antibodies is synthesized and that is generated in the blood sample, and when he is going to donate the blood, if there is a presence of these antibodies, you can test for hepatitis C. Similar way, hepatitis B is also there. Whether the antibodies are present in the blood sample, after donation you take the blood and ask for the radioimmune assay whether hepatitis B antibodies are present or no. Now, even though this is true, there are many what you are measuring the hormones level. You might have been knowing that this is a pregnant woman, the hormone levels are changing, from that this is used. So, if this by testing with this radioimmune assay, you can go for pregnancy test and all these tests. Now, even though this is true, there are ovulation, there are some hormones are required for the ovulation. If the woman is not getting any type of ovulation, at that time the doctor is advised to go for radioimmune assay, or they always ask for go for luteinizing hormone test. At that time, the people are using, the lab technician is using this test that is called as a radioimmune test. TSH, T3, they are used for T4, that is for thyroid function. Nowadays, many people after 40 and 50, they are suffering from thyroid. For that testing, this thyroid test that is carried out with the help of radioimmune assay. Hormones, anabolic steroids, and most of these steroids are taken by the athletes. You know the athletes and the cricketers, always they are taking some type of steroids. And for detection of the steroid, very little amount of the steroid is present in the blood sample. So testing for that testing, the radioimmune assay is carried out. Detection of the infection, you are well known with sexually transmitted diseases are there. Say for example, Neisseria, gonorrhea, say for example, syphilis. These sexually transmitted diseases, for that purpose, we can use that radioimmune assay. Like HIV, syphilis, chlamydia, they are used for hepatitis B, hepatitis C, Toxoplasma gondii. For that purpose, this test radioimmune assay is used. Now, allergy is the major problem nowadays because of the too much pollution. Now, question comes, how to detect the allergens? Now, a man is suffering from some allergen, then for what purpose the allergy is created in case of that man? Now, what is the agent of the allergen? So, detection of the allergen is very important. For this purpose, a radioimmune assay test is carried out. And that for that, when the allergy is there, at that time, sometimes the people are suffering from the allergy. The allergy is because of the dust. The allergy is because of the pollen grain. Allergy is because of the smell of the flowers. Allergy is the seasonal. When the summer season comes, they suffer from the allergy. When the winter season comes, they suffer from the allergy. So detect from which agent he is getting the allergy. That is the question. At that time, this is used because when he is suffering from some sort of allergy, the level of IgE antibodies are synthesized in the blood. And the suspected IgE, now the question comes, how to the suspected IgE is detected? For detection of this, the radioallogenous test is carried out. And with the help of test, we can find out the amount of the IgE is present, and we will find out the cause for the allergy. This is very important. The allergic response. Sometimes pollen grains, you smell the flowers, pollen grains, they act as allergens. This is called as a partial antigens. They are not the complete antigen. So this is a microphagocytic seeds also there. Now best example, you might have been knowing the weed comes in the congress, what we call in the congress, that generally comes in the rainy season, and when it gets the flowering, some people will get the allergy. This is very important. So the amount of radioactivity is proportional to the serum IgE, and we are detecting with the serum IgE how much IgE is present. Now, for autoimmune diseases, the best example is rheumatoid factor. What is rheumatoid factor? That is a rheumatoid arthritis. Now, there are some people are suffering from heart diseases. Some fever comes to the heart. And this is because of the rheumatoid factor. To measure amount of the rheumatic factor, this radioimmune test is used, radioimmune assay test is used, and the autoantibodies, I told you that the antibodies never synthesize against your own body, but sometimes it's a failure of the immune system because they are called as a sequestered antigen. These antibodies are synthesized against the auto, that is called as the autoantibodies. The best example is lupus erythematosus. Now next is measuring the toxin in contaminated food. Now the question comes, the food poisoning and food infection. Now today this is a current topic because the food poisoning is very important, and the food poisoning is because of the toxin secreted by the bacteria in the food. Now the question comes, how much toxin I have consumed? How intoxication takes place? To measure the level of the toxin in the blood, this test is used. Using radioimmune assay, you can carry out the toxin testing in the contaminated food. Now, detection of illicit drugs. The many people, they are called as narcotics. The cocaine they use, often are used, delta 9 tetracolonarbinol is used. They are active ingredients of the manjura. So these are the narcotics the people are using. This is all these are the drugs. Now question comes, how to determine the level of this drug in the blood. For this purpose, radioimmune assay is used. Now, how the detection is carried out with the help of simple technique is that, now just see this. This is a drug coated latex particle. This is called as a drug coated latex particle. Now this is antibody. This is a common reaction takes place, that is agglutination takes place here, and there is a agglutination latex particle. This is a agglutination, that is called as a granulation is synthesized here. This is a common reaction which is taking place in this. Now when this drug coated along with the antibody, if he is taking the drug, this drug will not allow the agglutination. This is very important, try to understand. And there is no agglutination. And when it is no agglutination is there, you can he is taken some sort of the drugs. So generally these are used in medical illegal cases. Thank you.